Welcome to the Occupational Therapy Assistant program at Wallace State. My name is Alan Keener and I'm the director of the program. The Occupational Therapy Assistant program at Wallace State has a long tradition of excellence in preparing students to become occupational therapy practitioners. Our graduates boast National Board Certification Exam pass rates and retention rates well above the national average for occupational therapy assistant programs and are prepared to work in a variety of settings ranging from skilled nursing facilities to acute care hospitals to inpatient rehab facilities to school systems and psychiatric facilities. As an occupational therapy assistant, you will work under the supervision of the physician and the occupational therapist to implement the intervention plan that has been developed in conjunction with the occupational therapist and the client and family. You might work with children who are having difficulty succeeding in school, a person who has had a joint replacement who wishes to return home and be able to cook for her family, or a maintenance worker who was injured in an industrial accident and needs to regain the use of his hand to return to work. This is a very rewarding field for individuals who are flexible, have a strong work ethic, and have the ability to think outside the box.
I chose occupational therapy because I got to experience some occupational therapy firsthand during my volunteer hours. I like how the therapist assistant got to work one-on-one with the patients, and I enjoy helping them get back to their occupations. Upon graduation, I will be working at a skilled nursing facility, working with the geriatric population. It's really interesting because upon entering the program, I had my heart set on pediatrics, and when I got a chance to work with the geriatric community in one of my level 2 field works, I really enjoyed it. I really enjoyed hearing about the stories, and I've loved it ever since.
When most people hear the word occupation, they automatically assume that means career. It's actually a very common misconception. Occupation is everything that you do throughout your day. That goes from getting dressed, bathing yourself, eating, going out and enjoying a run, swim. All of those are occupations. Where we come in as occupational therapy assistants is we're responsible for carrying out the treatment plans developed by the OTR and the client and their families to help them achieve the highest level of independence as possible. I actually was in an inpatient rehab, and I saw a lot of spinal cord injuries, traumatic brain injuries, and being there was very humbling, and you don't realize how important those simple things are as far as just being able to feed yourself until you're in that position and you can't do that. So it's very rewarding to be able to help people achieve that and all of their goals that they want to achieve before they discharge to home.
For more information on the Occupational Therapy Assistant program, you may contact me by phone at area code 256-352-8333 or visit the OTA section of our website at www.wallacestate.edu.